Hello, good morning, and welcome to this beautiful day and this beautiful program. My name is Gugu Eyala. You're watching Morning Spectrum here live on RSTV. It's been a while with you guys. Actually, this morning I have a very special one, a very special person, a guest that is going to talk about your health and my health, basically, aka HIV and AIDS. Actually, I have Dr. Uduak Daniel. She is the coordinator, South Zone, NACA. NACA, for your information, means the National Agency for the Control of AIDS. And then NACA is having a program in River State, trying to, they have actually a media parley, trying to talk with the media on how they can help to inform the public about the existence, and the disease burden and other things that still exist with HIV and AIDS. It appears that people are taken over by the so much about the media seems to have forgotten all about HIV and AIDS, and everybody's talking about COVID-19. Meanwhile, HIV and AIDS is still there, still killing people. People are still getting infected. And by the way, according to the recent statistics from the that is available, River State is quite high. I won't say our position there, so you don't get frightened. But River State is quite high, on the table. We have a prevalence rate of about 3.8%. Now, 3.8 might not mean anything to you because it sounds, statistically it means nothing. But what if I tell you that there are more than 200 or 300,000 people infected, and then 3.8 begins to mean something to you. So I have Uduak Daniel here, and she's going to talk about some of these things, some of these issues. You can be part of the program as usual. If you want to call 81 40 40, 1127, you can call that number and ask your questions. Madam, you're welcome.
Thank you so much.
Yeah. Okay. So you are here. First of all, why the choice of Port Harcourt for your program?
Okay. As a South zone, there are 6 states in the zone.
Yeah.
And there are so many activities we do. So what we do is we rotate.
Okay.
And it so happens that this activity falls into River State. And that's why we're here.
Interesting. I hope you're having a good time in River State.
I'm having a good time. Only the traffic in this place is
it's a blessing.
Very challenging.
Slows you down. Because anyway, you're having a parley with the media.
Yep.
Even though I gave some kind of intro, why are you having this discussion with the media? How can the media help you in your work?
Okay. So we know that we have a lot of stakeholders in the HIV space.
Yes.
And one critical stakeholder is the media. If you take time to look around, if a new product comes out, they're advertising in the media. Politicians want to tell people what they will do for them. They are doing whatever they are doing on the media. The media can make you
or my you. Okay, I'm just getting a signal from my operation director there, so we'll just take a very short break and then we'll come back and continue with discussion. Please don't go anywhere. Welcome back. Before we went on that short break, Dr. Daniel here, the coordinator South of the NACA, was telling us about the reason the party, the agency is having a party with the media here in Port Harcourt. Please go ahead.
Okay, so anything anybody wants to do, they have to engage the media as critical stakeholders. So in the face of competing public health issues, tuberculosis, now COVID-19, considering the fact that HIV has now even assumed a chronic state, that is, it's not acute anymore like COVID where it kills you or something happens immediately. It's a lifelong kind of thing. The likelihood in public health, in the public health terrain, is that whatever is coming up, it's a pandemic, attracts a lot of attention. But we miss out on the fact that you still have a lot of people that are living with HIV. So we felt that in the South, where we have the highest prevalence, 3.1 above the 1.4% national average, that we needed to continue to let the people know that HIV still exists, and the only people that can help us do that is the media. And the media doesn't just need to report. They need to be part of the program. They need to know what is happening so that they can report with the intention of also helping to reduce new infections. So that's the difference in this particular engagement, parley with the media, is to say, hey, how can we help you with our content so that you can help the public health practitioners with reports that will still make sure that people can change their decisions and infection reduces. That's what this is about.
So basically, what you want the media to do is behavior change communication.
Behavior change communication to be the part of the program. That's it.
Okay. The 3.1, 3.8 that is being talked about all over the place about River State is basically an average.
Yeah.
Not all the local government have that level of infection.
No, that's the average for the state.
Some are higher, some are lower.
Yeah. So where if you go to some local governments, for example, 9.8 of 3.1 or 3.8. Sorry. 9.8 or 3.8. So it means that there are some places in River State that have what we call concentrated epidemics, and those places need special attention.
Okay, quite interesting. Right now you're talking with the media. I will hope that someday, I don't know whether it's the responsibility of NACA or RISACA, go to those local government areas and do some more work. Who is supposed to take, for example, maybe I did not mention them here, but I understand that there are about 3-4 local government that's quite high.
Very high. Very high. And you can, if it's going to help the government of the day decide on what to do.
I think it's
nothing to be hidden. This is River State.
People need to know where the prevalence rate is quite
high.
Oh,
definitely.
I know that in Bonny local government, for example, in Kana local government, in
Gokana and Delimi,
yes. These are the highest,
yes, very high.
These are it's quite high in those 4 local government areas. Now, I don't remember hearing any serious activity going on in those places in terms of enlightenment or campaign or anything. And the question I'm asking is, who is supposed to do that? Is it the RISACA or is NACA?
So, NACA provides technical assistance and guidance to the SACAs. The SACAs, using the guidance that we give them and other policies in the state, work with local NGOs and community-based organizations, just organizations in the state, to do what they need to do. That's how that flow happens. So River State SACA is supposed to be working with the non-governmental organizations and the community-based organizations in the state to get to those places. And I'm sure they are. And that's the reason why we want you involved, because if you are more involved, you will know what's going on in there. But quite a lot is happening too.
We have this issue of international donors, leaving the state and going to other places. Right now, as I speak, for the last time I had any communication with the Uduak State Agency for the control of AIDS. It told me almost all the international donors have left. So they're just left only about 1 or whatever. But from the national point of view, what's the problem? Is it politics, or what is it that the place is not conducive for them to operate, or what do you think is the problem? Why do they have to abandon the state?
So abandon may not be the right word. You see, it's even sad for me as we talk about donors leaving, because what donors do is that they are supporting, it's another country supporting our own system. So whenever I talk about donors leaving a state, in this instance River State, it's pretty sad, because what it means is that, and I might sound very, is it cliche or more, that the government is not doing enough in the HIV sector. If a donor leaves and there are remarkable gaps, then it means there's something the government is not doing about that sector. Well, River State had a lot of international partners until about 2 years back. You see, every partner has its timetable, has its work plan. And Rivers, having been in the international partner space, was that there was something they had noted based on research that we provide from the national, and they needed to mitigate. And when it gets to a certain level, what happens is that we move into something called maintenance behavior, which means that we've taken care of the emergencies. Now what should happen is maintaining behavior so that we won't have high incidences or high new infections. So it's possible that the donors have reached that stage where they think it's about time for River State to have behavior maintenance programs. Or also, there's a lot happening in different places, and River State in recent past has had a lot of fracas happening everywhere, and that of course drives donors away. Not categorical, just two instances.
What you're telling me here is one. The donors feel that the state we are in now, the state government can take over from there.
Oh, definitely.
Like you guys have money.
Definitely.
You guys have money, so you can fix it.
Definitely.
So let's go to states that may not be that rich.
Definitely. Or have issues now that we need to mitigate.
Well, we have come up, we have worked with you to the extent that we feel right now.
Take over.
What you have, you can take over.
Definitely.
That's number one. Then number two, what you're saying is that negative publicity might be also affecting the state.
Definitely.
That's because for about 2 or 3 years running, this steady negative publicity of the state has been violent and all that.
Yeah.
And that might have also informed the headquarters, whether in America or whatever, they say, you guys need to move out.
Yeah.
You're not safe there.
Definitely.
So we are losing from all those negative publicity.
Definitely. Yes.
Anyway, it's quite interesting talking with you here, because we people are a little bit confused. We hear that you guys now have self-testing kits.
Yeah.
Somebody needs to go to the hospital, we can have a self-test kit and test yourself whether you have HIV.
Mm-hmm.
But before we start talking about that, I want to know the thrust now. What is the focus now? Are you guys the focus of NACA? Is it on testing? Is it on treatment? Is it on prevention? Where's your focus now?
So NACA has always been a multi-sectoral thing, and we coordinate the national HIV/AIDS response, whether in the health or non-health sector. Okay, just the general coordinating entity. But NACA's main thrust is more of non-health sectors, and right now non-health sector thrust is mainly prevention. Okay, and now we have, it's always been and it will continue to be, because that's the entry point, knowing your HIV status, and that's in testing. Now we are saying to people, there is no barricade anymore. You want to know your status personally, they are now self-test kits. So HIV testing services still number one on the list. And then we have pre-exposure prophylaxis. This is also a focus right now, saying if you have two discordant couples, what I mean is one is positive, the other is not, or one engages in very risky behaviors and doesn't know whether the other person is positive or not. Save yourself the trouble and go into pre-exposure prophylaxis for a certain amount of time. I won't be able to tell you all the details right now, but that's what it is. And another focus is also prevention of mother to child transmission. Nigeria still contributes the highest now, or second highest, to global mother to child transmission rates. I mean, it's very low. Mothers are still transmitting to their children, and there are many factors that that are responsible for that.
So supposed to be taken care of by the antenatal stages.
Yes, that is where it's supposed to be taken care of. But how many people go for antenatal? How many people go for antenatal? And there are so many reasons why a lot of women don't go. So yeah, there was a time we had a program. I mean, it was general. Oh, get the women to go for antenatal. And yeah, they will go for antenatal, but when it's time to deliver, they go to the traditional birth attendants that they go to. I mean, this thing is still a matter of behavior change, and that's why we need to engage the media to help us continue to reinforce messaging. Very important, because a human being does not decide immediately. Has to hear over and over again to be able to start considering even what you are saying, especially if he had already had some preconceived notions. You understand? Takes time for that to happen. And that's where we need the media to just continue to say this is what it is. And there are other factors. For the woman who goes for antenatal, distance to the clinics. Yes. The attitude of the healthcare provider, and I keep saying, healthcare providers like us, we just need to be friendly people. That you need even some measure of behavior change communication. Interpersonal communication is a skill. You are not born with it. So those are the kind of things that we're. So for NACA, HIV testing services, priority. Pre-exposure prophylaxis, priority. Prevention of mother-to-child transmission, priority.
Okay, let's talk about the testing kits.
Mm-hmm.
An individual wants to have it. How does he get it, and how much will it cost him to have a pre-testing kit?
Okay, so
self-testing kit.
Yes, so the self-test kits are available in pharmacies, not patent medicine stores.
Okay, in pharmacies.
In pharmacies, that you have a pharmacist, because when you go to get the self-testing kit, you're going to have to talk with the pharmacist, who will do some sort of pre-test counseling and say to you, do you want us to assist you do it here, or you want to do it over there? They will get, because our society is still not mature to the level where like outside here, where people do the thing and respond immediately to whatever. Okay, we are still very sentimental about things here. So it's a guided thing. Do you want us to assist you? So there's assisted self-test, and then the one that is unassisted. But if you get back and you do it yourself, what it means is that you're going to have to get back to us. These are the conditions in which you use this kit. You have to observe these conditions. And when you even do it, you have to get back to us, so that whether you are positive or negative or indefinite, we can guide you to go do a confirmatory test, so that you really know whether you are infected or not.
That brings me to the next question.
Yeah.
How efficient? how these test kits?
Very, very
How
efficient, very reliable, very efficient, 99%. So long, reliable and efficient, so long as you use according to the conditions that you.
Are they easy to use?
They are easy to use because in the kit, I wish I had one here. In the kit, you have the guiding manual. It's a very simple thing that guides you on what to do.
You bleed yourself?
You don't even need to bleed yourself. It's oral.
It's oral, eh?
Yes.
Okay.
That's why it's called oral quick. Yes. It's a swab.
It's a swab.
Yes.
It's a swab.
Yeah.
And then,
Yeah, and then you put it in a buffer and you wait for some time. And for that particular time or that duration, because anything above that or before that might earn you false positives or false negatives. So you just have to follow.
So
Oh
timing
yeah.
is very important.
Oh yeah.
Okay.
Very
So,
but it's very easy, and I don't know how it is, but working with partners, it's between 1,006 and 1,008 for the kits.
but okay, that is if you get it from partners.
No, I mean, because it's partners right now that are providing it. Yes, because we are regulating this thing and making sure that people don't just bring things from anywhere. That's the range.
Okay, so if you're watching this program this morning and you're watching Morning Spectrum, my guest here is Dr. Uduak Daniel. She is the coordinator, National Agency for Control of AIDS, in the South Zone here. She's having a program here, Media Pally with media men, and we're talking about the HIV thing, the AIDS thing. Somehow COVID-19 has now pushed all diseases to the back, to the background. Even though malaria kills more people than COVID-19. Nobody's
Oh wow! Yeah.
Nobody's talking about malaria, and then many other diseases and all that. Now, there was this question yesterday about the relationship between COVID and HIV and somebody that has HIV, somebody living with that disease, treating it, looking normal and everything. The COVID it's worse when you have some underlying diseases. Could it somebody living with HIV and be categorized as somebody having living in an underlying disease?
Oh, definitely. Oh, definitely. Anyone who is living with HIV also has is categorized under that group, and that's why they are also mentioned when we warn people that they should be careful, they should observe all the prevention guidelines or the prevention protocols for COVID-19, so that they just don't predispose themselves to COVID infections.
Okay,
yes.
let's talk about prophylaxis. We don't have much time, say in the next 2 minutes. You talked about how many hours can somebody who feels he or she has been exposed, can take that medication and then be safe. How many hours can?
Okay, so I'm going to be careful how I dish out information right now, so that people won't say Dr. Uduak came to River State and said this and said that. I would only say that it's an algorithm. There are things you look out for. There are things that are criteria. There are criteria for people who are eligible for pre-exposure prophylaxis. There are criteria for people who are eligible for post-exposure prophylaxis. Post-exposure prophylaxis, you've already exposed yourself to it. You need to mitigate immediately or stop whatever may have happened in the system within 48, 72 hours. That is okay. You get very effective. But I always advise immediately. Just get to where you can be provided the service. But for pre-exposure prophylaxis, permit me not to say too much about it. Only I can say to you, you get to a clinician or a medical practitioner or a pharmacy, and you say to them, this is what it is, and then they take you through the algorithm, because there are certain things we look out for. Yes.
Okay, we don't have much time, so I think we have to leave here. I wanted to ask a question. Everybody's doing research trying to get the cure,
There's no cure yet. There's no cure yet.
Vaccine, and you guys are not coming up with any vaccine.
Not yet.
Okay.
No.
Anyway, thanks for coming around.
Thank
I'm very
you.
grateful to have you this morning.
Thank you. I'm looking forward to seeing you two over there.
Okay, I'll try my best to be there.
Please.
And you out there watching, thanks for watching. Stay tuned for more beautiful programs coming from RSTV. Once again, my name is Gogo. Bye bye for now.